As a physician in internal medicine or family medicine, or if you're a primary care physician assistant or nurse practitioner, depression is something that we see on a regular basis. We often have to manage it with pharmacotherapy, and SSRIs are a common first-line medication. However, not all SSRIs are the same. I'm Dr. Pillay with CME Travel Academy, where we provide continuing medical education to physicians, nurse practitioners, and PAs. Our goal is to bring you guideline-based medical therapy that's evidence-based on the latest 2026 guidelines. In terms of treating depression with SSRIs, we know that all of them are not created the same way. And what I mean by that is look at fluoxetine. If you have a patient that's very depressed and very sad and needs a lot more uplifting, fluoxetine is a great choice. It's also a great choice in patients who don't take their medicines every day because it has the longest half-life. If you have your patient on sertraline, it's a great medication. However, it does not work very well at lower doses, so higher doses tend to work better. If you're a patient who's male and has depression and also needs some medical therapy for premature ejaculation, then paroxetine is a great choice. But if that person is not very compliant with taking their medication every day, paroxetine becomes a poor choice because it has the lowest half-life or the shortest half-life, so they can get rebound side effects if they miss a day or so. If you have a patient that's older and has multiple medical problems and takes several different medications, then Lexapro or escitalopram might be a great option for them because it has the least drug-to-drug interactions. So as you can tell, not all SSRIs are the same. So we help you learn about the different medications. When we go to another first-line medication like SNRIs, the name implies that the amount of norepinephrine and serotonin impact is about the same, but it's actually not. If you look at most of those SNRIs, they have minimal dopaminergic activity, and the ratio of serotonin to norepinephrine is actually not 1-to-1. In fact, with venlafaxine, it's 30-to-1. So it has to hit 30 receptors of serotonin before it even will help any kind of norepinephrine effect. Duloxetine is a little better, and then venlafaxine is a little better, but none of them are 1-to-1, like, for example, milnacipran. However, milnacipran is not approved for treatment of major depressive disorder in the United States. There are other first-line medications like bupropion, mirtazapine. We go through each of these medications, but we also teach you how to do a proper history, how to use the screening tools and be able to gauge your patient's needs. And when your patients are actually well controlled, how to help them get off the medications. If your patient needs 1, 2, 3, or more medications, we'll help you manage those patients for treatment-resistant depression. When to add the antipsychotics and what the differences are between some of the newer antipsychotics as well as the older ones and when they apply. In addition to depression, we address the top chronic conditions at every one of our conferences, including 1 hour of ethics. So we address dementia, heart failure, diabetes, lipids, coronary disease, and much more. All the things that you see on Monday through Friday in clinic, we address. Come learn about the latest guidelines from 2026. Learn about the evidence-based approach that is guideline-driven on managing the common chronic conditions that you see on a daily basis. We have upcoming conferences, as you can see, in Orlando, Disney World, New York City, and Las Vegas. If these locations don't appeal to you, that's okay. Use our CME live stream option and use your CME funds and use your CME time off to go to any location you want, whether it's an all-inclusive or it's a cruise or just staying at home with the family. We also have custom options where you can create your own conference using our funds as well as our options to be able to create a location that you want, a venue that you want, and even the topics that you want. If you're an organization looking to have CME for 10 or more providers, contact us directly. We can also include that for you. Either way, check us out at cmetravelacademy.com if you want to keep up with the latest medical guidelines and the top chronic conditions. I'm Dr. Pillay with CME Travel Academy, and we hope to see you soon at one of our upcoming conferences. Thank you again.